big bula vinaka to everybody joining the feed. Just getting a bit things lined up here. Welcome to the program. Welcome to the feed. My name is Param here in Sydney, Australia. Do share with your family and friends. And let's get a bit of a nice jazz ball rolling. It's Sunday today here in Sydney. How have you been? Let's share the love. And while I just gotta share the feed a little bit, give me a couple of seconds while you join in, and your friends can join in as well. Yes, do share it amongst your family and friends so that we got a little bit of story going here today. Good day, good evening, good morning, good afternoon, whichever part of the world you're watching this feed. I'd like to welcome you on. My name is Param Shivan and I'm residing in Sydney, Australia. And for those who are watching this for the first time, I'd like to welcome. Today I've got a guest here. Now, I forgot to ask your surname, but I'll ask your surname because it's hard to pronounce and it's easy to pronounce. Depends how you pronounce it. You know, I think it's Howea or Howea. In Australia we say Howea, and I think it's Howea. So please do share this via a feed amongst your family and friends. And today the topic is about Fiji health check. So yes, Dr Jone Howea or Howea. Let me just reiterate that, and hopefully Jone, I haven't done it wrong. Bulavinaka and welcome, Jone. How are you today?
Bulavinaka, Param. Yes,
apologies.
You are right.
Is it Howea?
It's Howea or Hawaya.
Hawaya, as they say in Kiwi, Hawaya. Welcome to the program. How are you, sir?
Thank you. I'm well, thank you. It's nice and sunny and windy here in Lautoka.
Yes.
For those of you who are linked to Lautoka in one way or another, Bulavinaka.
The Sugar City, eh? Well, which one is your soccer team?
Yes.
You go for Lautoka as well?
It's crushing season here in Fiji, so we have the wind and we also have a little bit of the dust from the mill. It's all part of the sweetness of Lautoka.
Yes, of course. Yeah, that's the sweetness part of Lautoka. How have you been anyway? How's things over there at the moment?
Well, it has been good relatively. Yeah. I cannot speak for the thousands of families who are impacted by this Delta variant pandemic here in Fiji. But we are good as a family. Thank you.
Okay, that's good. And family is all good, fit and fiddle, as they would say in Fiji. So, Jone, tell me what's happening. What have you been up to? I mean, you're a medical doctor there in Fiji, and tell us a little bit about yourself. So let's see our family and friends can get to know you a little bit more. I know you're looking handsome, you've got a good physique and a good smile and a good voice. They all have to go with the tone, Jone. Come on, let's go.
I like the Australian way of describing me, but thank you very much. I graduated from the Fiji School of Medicine when it was still part of the University of the South Pacific.
Yep.
with an MBBS, and I did my internship in Lautoka Hospital. I was posted to Taviuni. I did a little bit of work in Tavua and Navua Hospital. Taviuni, I worked there for a while at the subdivisional hospital in Taviuni. And then I joined Lambasa Hospital. First at the outpatient and emergency, because those two in Fiji, those two have been under one roof, if you like to put it that way, for a while.
Yep.
And then I joined the surgical department.
Okay.
I did a tour of duty with the Fiji military forces to the Middle East. I also did a few private work in the Pacific.
Wow.
I did my postgraduate studies again at the now, because the medical school is now with the Fiji National University after a bit of the restructuring of our university and the establishment of Fiji National University. So I did a postgraduate diploma in surgery. I was particularly interested in trying to do something about diabetic foot infections and amputations.
Yes. Have you done a lot of amputations, I believe?
Yes.
Chop, huh?
Chop. And I was trying to figure out a way to do something about it within the surgical institution. You know, our health system budget and our economy cannot afford subspecialty to that level.
Okay.
So I had to try to choose advocacy.
Okay.
And I did that from an NGO called Friend. I was the associate director.
Oh, yeah.
For Friend, which is a Lautoka-based NGO. For about 6 years. So because that position required me to do a lot of community development programs. So it was an opportunity to combine community development and public health and advocacy. I found that to be quite effective in trying to advocate for health issues. Now I helped design the the Pacific Island Food Revolution TV show.
Okay,
because in my efforts to try and prevent NCDs and to promote well-being and local food, and I'm still on at it until today.
Oh, that's good. Yeah, it's always good to hear good things happening in Fiji as far as medical is concerned, because as you know that NCD is in a rise, and I would definitely bring along a program one day on the NCD as to why. Now, let's get to some questions. I'll be keeping this forum as clean as possible and as good as possible, so that our family and friends can get aware of what is happening. As the topic says, let's do a bit of a health check in Fiji. Now, and I'll try to keep all the questions and not as very hard as possible, Doc, and make it simple for you and for the viewers as well. So you did surgery. What sort of surgeries did you do over there, Doc?
Our surgical program allows us to do general surgery, general orthopedics, urology, and ear, nose, and throat. And because we cannot really establish subspecialties any more than that, we go through all those departments in our surgical training, and we learn how to stabilize, specialized cases, and collect all these and allow for the specialists from Australia, New Zealand, and other
Mm-hmm.
overseas countries
Mm-hmm.
to come and help, do their further specialist work on it. So
Yep.
that's
Yep.
how our program is like. And so sometimes we are referred to as, jack of all trades, masters of
Yeah.
nothing. But it suits our need. It suits
Yes.
our the resources
Yep. Yep.
available, and how the health system has had to try and slowly evolve the specialist programs over the
Yes.
years.
Yes. Yes.
Yeah.
So, tell me. I just want to ask one question, which is probably out of the context. The context: do they do knee replacements in Fiji?
We are starting to do that,
Okay.
but in the private hospital setting.
Yep.
Um,
Yep. Yep.
yeah. Um,
Okay. Hospital setting. Now, also, I've seen a little bit about your online service and the M-Pesa, and it sounds good. Can you tell me a little bit about on that and how you've been achieving that one, the online service that
Last
you're
year,
providing?
yeah. Thank you for taking note of that. I established it last year because of
Hmm.
the lockdown
Okay.
that COVID had, and I realized there's this huge technology platform that is
Yes.
there that allows for people to have medical advice.
Okay. Okay.
Clear, concise advice is very helpful,
Hmm.
and it also takes away the load from mainstream health facilities.
Yep.
And I found that it's relevant to our current situation right now, and I
Okay.
put it out there
Hmm.
as means of access to anyone. Of course, it's self-funded, and so
Okay.
I have had to try and put a little bit of cost to it to pay for
The
the
running of it.
regular bills
Yes. Yes.
of running it. Yes,
Yes.
but it's all a referral system.
Uh
I
huh.
can refer for a prescription. I can refer for further specialist care.
Yep. Yep.
While I'm in my farm and doing agriculture and food and cuisine in this healthy and well-being work, I'm
Yes.
able to help a few others in advice, in
I can
medical
see I
advice.
can see a coconut tree right at the back, at the behind you. Just there is a coconut tree. What do you plant over there,
Yes, yes.
Doc? What do you plant in the farm?
Well, this is my home in Lautoka, and it's
Okay.
surrounded by flowers and palm trees.
Mm-hmm.
I like to live surrounded by plants. It helps give
Yes.
me healthy air and oxygen to breathe in. And
Yes. Very true.
in
Very true.
Lautoka, it's a bit hot, so it cools our place.
Yes,
Yes,
of course.
so
And it's now winter season in Fiji, which I love the weather this time of
yes,
the year. It's
yes.
lovely.
If we can call it winter, we'll call it winter.
Because I've seen people wearing beanies and stuff like that in Fiji. It's kind of
Yes,
amazing when
yes.
we go there in shorts and they're in beanies. So it doesn't make sense. But
Yes,
it's a lovely weather this time of the year. Now let's get to the
it
nitty
is.
gritty of the program, and it's a health check system that we are more concerned about as to what's happening and why and even. But many questions will arise, Doc. But nevertheless, I think we're here to preach. We're here to put the words out there to the people that as to what's happening, so they can decide the pros and the cons. As I say, every film is different. One's got romance, one's got drama, one's got horror in it, and at the end of the day, it's us who are going to decide if we like the film. So moving forward, have you worked with or met any spoken to any pre or post COVID patients there, Doc?
Yes, yes. I have met with quite a lot of post-COVID patients, and by
Mm-hmm.
post-COVID patients, mostly asymptomatic
Okay.
positive,
Okay.
asymptomatic positive. Yes.
Yep. So they would have had the blood test, I suppose.
Not blood test,
Yep.
but swab,
Just a swab.
the nasal swab, the
Okay.
nasal swab
Okay.
test, because
And
that's what we are using here.
Yep, yep. And how are they? Are they in good shape and good health and wealth? And
Well, yes, generally,
Mm-hmm.
because some of them are diagnosed from the contact tracing.
Okay.
Well, most of them are diagnosed from the contact tracing.
Mm-hmm.
Um, I haven't actually had I haven't actually met somebody who was diagnosed after presenting to hospital with
Mm-hmm.
with symptoms.
Yes, yes, yes.
But I've met relatives of those people. Yes.
Okay, okay. And suppose they'll all be. And has Fiji got a post COVID trauma setup centers, anything like that over there at the moment?
If well, we do not have actually a an established independent organization, if you like.
Yep, yep.
We haven't got that. We only have the Ministry of Health
Mm-hmm.
and the government, and that's it.
Okay.
So there is no independent body
No
doing
NGOs
some.
either.
No, no.
Okay, okay, okay.
Um,
Because obviously there will be some sort of a, since it's an inflammation disease, obviously it is going to there have to be some sort of a side effect being having a post coming through the COVID. As like any inflammation diseases, they leave a little bit of a trail, as you would know, like a disaster. They always leave like a
yes,
tsunami comes, they leave something behind. Nevertheless, that's
yes,
good to hear
yes.
that they're in good shape. Now, what ideas would you think the Fijian society considers important in this crisis at the moment? Would it be money or open dialogue or lockdown? What ideas would you think the Fijian society considers important, very important at this time of the crisis?
I think, Param, it's a mixture of all,
Mm-hmm.
um, because COVID-19 impacts everyone differently.
Mm-hmm.
Um, for those who belong to the whose families heavily depended on the tourism industry,
Yep.
its income and the economy, and that would be top in their priority. How can we quickly get towards having the tourism industry up on its feet again and moving,
Yes.
so that income comes to the family and life
Mm-hmm.
begins to make sense?
Yes, yes, yes,
For
very true.
those who are not so closely linked with the tourism industry, it would be, what is this COVID-19? How affected are we? And the issues that the pros and cons discussions about it.
Mm-hmm.
For those who are out there in the farms and rural villages,
Mm-hmm.
again, it would come to because their produce are not able to go to the market.
Mm-hmm.
So it comes down again to income for the family.
Mm-hmm.
So, and the economy of the village and the families in the village.
Mm-hmm.
So it's affecting everyone
Across
depending
the
on our location and what was the priority
yes, yes,
before COVID.
yes.
Yes,
I suppose a lot of people had jobs. I would imagine. I could only visualize that all the hotels and all the buses, all the taxis, all the cars that run that brings the tourists back to the hotel. All those would probably be
yes,
standstill. All those lovely motels and hotels that be biting the fingernails to meet the dead ends meet,
yes,
and I can just visualize. If anybody would visualize that, it would be a standstill. It would be just like the Middle East during the war. And
yes.
if you resemble it that way, it could be really harsh at the moment. But nevertheless, it's good to see and good to hear what's going on. Now, if I were to say to you, Dr. Jone, the topic is health check today, and in Fiji's health system, you know, if I were to say, Doctor, here, come on, let's do the health check of the Fiji's health system, what would you do, Doc? The structure, the governance, the state of art, technology. It's interesting. I'd love to know what's going on in there. So if you would say, look, you put up your little coat and say, okay, guys, let's do a health check and audit it. What would be,
Mm.
what would you be doing? What would you be checking out, or what you be bringing in?
In all audit, we have to consider past,
Yes.
and what was the past situation,
Mm-hmm.
and then we can come to the present, and
Yep.
then we can give an outlook and forecast what it
Yes.
would mean for us in the future. So in 2018 and last year in July,
Mm-hmm.
Shamil Chand and his group did a NCD and economy study.
Okay. Okay. Who's Sanil
This was
Chand?
published. Yes.
Who is Sanil
So
Chand?
this was published. Shamil, I
Oh, okay.
think, but Chand and SS Chand and his group.
Okay. Okay.
So they
Okay.
did a study of the economy and NCDs,
Mm-hmm.
and it was published last year in July.
Yep.
So that is the most updated information about our health system,
Mm-hmm.
and 120 to 180 million dollars
Wow.
is spent, and that's mind you, that's a conservative amount.
Yes. Yes.
120 to 180 million dollars used on diabetes alone.
Wow. Yes.
Yes, on
Wow.
diabetes alone, and to manage diabetes. So
That's a lot of
you
macaroni,
haven't
as we
counted
say.
cardiovascular disease. Now,
Yes.
cardiovascular disease is double
Wow.
diabetes.
It's a free write-off on the death certificate. Cardio died of heart
Yes,
attack. That's it.
yes. And when you have deaths, you have lost opportunities for productivity.
Very true.
Uh, that's lost GDP, if you like to talk
Yes.
about the economy that way. Yeah.
Yes.
And
Yes.
so
Yes.
it's a clear study of how our health system was already overwhelmed by
Okay.
NCDs alone.
Yes.
And this was just four of the major NCDs.
Mm-hmm.
So that's where we were. And so when COVID came in,
Mm-hmm.
we were already overwhelmed.
So now we are saturated. It's overflowing at the moment.
Yeah. And
And all
so,
this.
we are talking about ICU, acute wards, emergency departments, all of the departments in health. You're talking laboratory,
Mm-hmm.
X-ray, the nursing stations, the health centers, the subdivisional
Yes.
hospitals.
Everything
That's
is.
why there have been meetings after meetings of government with the multi sectors in
Mm-hmm.
trying to map a way forward. We had a multi-sector meeting
Mm-hmm.
in the last weeks when COVID was beginning to be announced in Fiji. We had
Wow.
that at the Pearl Resort, and we had the agriculture, the Itoke Land Trust Board even was there.
Okay.
The forestry department was there, fisheries,
Everything.
NGOs,
Mm-hmm.
the academia was there, and we were doing this NCD
Mm-hmm.
conference, trying to map a way forward, and it was disrupted by the COVID announcement, and the
Mm-hmm.
permanent secretary then, Bernadette Wells, had to leave because of COVID-19.
Ah,
And
okay.
so everything was put on a full stop, and the emphasis was placed on COVID-19.
COVID.
So where we are at,
Mm-hmm.
we have this big population of NCD patients.
Yes.
We have all these services that were running,
Yes.
and all that had to be put on a stop while the emphasis was placed on the COVID. That's
COVID
where we
was.
are.
Okay.
Yeah.
Okay. Now,
And
this
so,
question that I'm going to ask you is it's not to undermine the current quarantine and border control principles and procedures. Just out of curiosity, Fiji went through a golden phase, and I would like to call it golden goose phase, with COVID initially in 2020. That's how would I put it, because I was there in February, and as soon as I left, it went bang log. And so in 2020, on March 26th, the international airport was shut down. It was closed, and then people had to go home. Then they had 49 cases of COVID back then, 49 cases till December 2020, and then until it sort of followed again, and then it went into April, a big surge. Now the surge, there has to be a reason for that surge, and obviously, some people would probably know why the surge. It had a golden goose period, lots of parties going. Christmas was lovely, and it was all golden, business was all humming, and while all the rest of the world were, going through trials and tribulations of everybody, they're burying people out there. We could see in television with all the social media what was happening in India and Italy. So we were bombarded about it every day. Yet a paradise like Fiji, everybody was enjoying. What happened? What was the change? What was that knock on the door? The door got open. What happened over there, Doc?
Our preventative health people were working very hard.
Mm-hmm.
Despite the limited resources. And when I say that, in an outbreak, usually the health authorities define the case.
Yes.
And when I say that, I mean, what are the symptoms, what are the signs, and then what are the tests that we look for in patients that will define the extent, of the outbreak. But we were left with fever as our case definition, and that's understandable, because in public health, in preventative, in the management of outbreaks, we usually start with a broad case definition like that. So
Yes.
Everyone with fever has to be suspected as having this disease.
Yep.
And then we do our further investigations to clearly define whether this is really COVID or another source of the fever is what's causing the fever. So we did all that last year, and that's why we only had 49 positive cases.
Odd cases, yeah.
Yes. Yeah. So, like you said, in the beginning of this year, the world over was aware of Delta variant in India, and so as mind you, last year we had all the lockdowns, the quarantine and the isolation and the 2-meter distancing,
mask, everything
the closure
was going
of villages, and so on. And so our health people are able to do that because our Public Health Act and Quarantine Act and the provisions within the Constitution are clear, that we can enforce public health measures like that if people are seen to be non-compliant.
Okay.
Yeah. So just to enlighten you a little bit, there's a clause in the Constitution, in the 2013 Constitution in Fiji, that says that in the chapter on Bill of Rights, Section 9G, right after the section on right to life, there is the section on your individual rights, and it says that your individual right can be forfeited if it prevents the spread of an infectious disease.
Okay.
So all the preventative health measures, and your individual right can be forfeited for the sake of the rest of the population, because the High Court can be asked to make an injunction, an order, to forfeit your individual right. If you say, no, I want to work, I don't want to be quarantined, then that the High Court order can be slapped on you, and say, because of the larger population.
Yes. What happened?
So
Yeah. My prime focus would be on the Delta variant. How
yes.
did any idea how did the Delta variant made across that border control of the airport? And I presume that's why it's sort of
So so
the
we
hero.
had two individuals. We had two
Okay.
individuals that came from India,
Okay. All right. Okay.
uh, and
They were like
uh,
two separate
and
individuals.
they are citizens of this country. Um,
Okay.
so whether they are citizens or not would be irrelevant. The issue of interest is two
It's a threat.
individuals came from a
Yes. Very true.
hotspot of Delta variant.
Yes.
When India was declared a hotspot
Hmm.
globally,
We stopped. Australia stopped the
every
flight. Australia stopped the
yes,
flight.
yes,
Said bang. No way.
yes. So every public health system in the world
Hmm.
will put its surveillance system on a red alert. You
Of
know,
course. Why not?
and surveillance in terms of border control
Yes.
is a working together of the health inspectors
Hmm.
who are law enforcing officers when it comes to health,
Hmm.
and working together with the immigration and the government behind them. The office of the Minister for Health, the office of the Prime Minister, and the office of the Attorney General are the leading authorities
Hmm.
behind these officers working on the ground.
Yes.
So even when they buy their ticket in India,
They would have known straight
the
away.
immigration would alert
Mm-hmm.
um, the health authorities that, and of course, alert the government that there are two individuals that have applied by buying their ticket to come to Fiji.
Okay.
And if it's on red alert,
Mm-hmm.
there the order will go right there,
Straight away.
and just ask them not to proceed any further. You
Yes.
are in a hotspot. We will, as the government of Fiji,
We will not
it's
allow.
a responsibility to look after your stay. We'll
Mm-hmm.
ensure that the health system in India is, is made
Mm.
aware of your presence, and we will do our best to look after you.
Mm-hmm.
But you cannot come because we will refuse entry, because we will forfeit your rights as individuals.
Yes, of course. It's a natural disaster. That's company, and of course the
Yes,
red alert, and of course, oh come on, it's a Delta
yes,
variant, and I think people would have
yes.
known. Even the health ministry should have known. Hang on, let's put a stop to it. It's like putting someone
Yeah,
away in a jail. It's a threat.
yes, yes. Because we have to consider the 896,000 people
Of
that are in
course,
the country.
that are in
Yeah.
danger.
All the
Yes.
lives, young and old. It's irrelevant what ethnicity, what is your status, your occupation. India is a hotspot with
Mm-hmm.
Delta variant.
Mm.
We have to protect your lives and take care of this situation
Yes, of course.
by implementing what is already by law and
Mm-hmm.
evidence based. We know it works.
And it should have been strengthened
Um,
at the border itself. So that's obviously made it through the
yes,
border and the Delta variant,
yes.
and then look where we are now.
So these two individuals were allowed to leave India.
Mm-hmm.
They were allowed to enter, to disembark the plane.
Oh, okay. No quarantine?
Uh, well, quarantine measures were applied, but it's Delta variant. You
Yes, of
don't take the
course.
risk. Yeah. You don't even allow the plane to enter into our EE zone.
The plane
EE
would have
zone.
gone. Yes, of course, of course.
Yes. We have the sovereign authority to tell the plane to
To go
turn
back,
around.
turn around.
Yeah.
True.
We have the sovereign authority because we are protecting the lives of almost 1 million people in Fiji.
Yeah, just going
And
back,
as
just going back over there, Doc. These we go, but let's go back in 1918 when the Spanish flu hit Fiji, and most of them were coming.
yes,
Spanish flu was the very first flu that the world was not aware, and it killed
yeah,
back then 9,000 people back then, which was 5% of the Fijian population back then. So the history states that virus is dangerous back then.
yes, we and also history has made us make that into evidence-based practice.
Yes, of
You know,
course.
it happened. There is evidence for it, and that's why we have these public health measures.
Mm,
It works. It has stood the test of time, and so prevention is always better.
very true, very true.
Prevention is always better. There's a reason why things happen in the past, and there's a reason why we have to learn from it. And
That's
there's a
true.
reason why it has made it. All this evidence has made it into law
Yes, yes, yes.
because it works, and it
Yep.
works to protect the lives and the health of people.
So currently we
So
are
yes,
standing with
you are very correct there.
so
Absolutely.
many issues in Fiji. The NCD, as you said, is like myself. My study shows there's about 33%, just a let alone diabetes people in Fiji. As you said,
All the more
heart attack.
reason,
Yes,
all the more reason, all the more reason we have to be very vigilant
very diligent as well.
when it
Yes,
comes to surveillance and border control.
very
And
true.
we have to apply all authority
Yes,
and find out every resource we have to protect, to prevent entrance.
yes, yes,
And, the Office of the Attorney General is
yes.
responsible for legal advice to the Prime Minister and to the Minister for Health. And so
Okay,
the Office of the Attorney General knows that there are provisions in the Constitution to get the authority to
to get
make
the
such
medicine.
moves.
Yes.
Why
Could
that
they?
did not happen
Hmm.
is the big question.
Okay,
Yeah,
that's a big
that did
question.
not
Yeah.
happen. Yes,
Could there be
the
a
Office of the
possibility?
Attorney General urged
Yes.
in its position as legal advisor to
Yes.
the Office of the Prime Minister and the Office of the Minister for Health.
Okay.
And it's not a small
It's a big.
it's a huge flaw in decision making.
Okay, I would say it's a flaw in the system that and the communication system that it didn't from the border a phone call away to the administrators and saying, hey, look, we've got this to deal with. What do you reckon we should do? Should we close it
Red
down,
alert,
Silver City?
red alert, param is a phone call.
Yes.
When a disease is on our top priority surveillance list,
Mm-hmm.
it's a phone call. And
Wow.
if phone call is not able to be done, then in person, but it must be done immediately.
Immediately, there's a threat.
That's
Yes.
what that's how our surveillance system works, and
Mm-hmm.
that's how preventative public health measures work. That's why we have certain diseases on our surveillance system. Certain diseases only requires us to notify monthly,
Okay.
some weekly, some daily.
Yes.
But when it comes to a global pandemic such as this, and the Delta variant is being globally made aware to every
Yes.
country, then it's a phone call. And the authority has to be made by a phone call immediately.
Straight away.
Immediately.
Yes.
Everyone is notified, everyone is told what to do.
Mm-hmm.
And the decision has to be made immediately.
So
So
now,
once the ticket is bought in India,
yes.
an immediate decision has to be made.
Wow. Straight
Yeah.
away that we're
That,
not going to
that's,
let this
that's
person
what
in.
red alert surveillance means.
So obviously there's a break in the system. The break in the system, in the chain, one leads to the other. The main person, as the prime minister of the country, he's got his advisors over there. Probably he was not advised. Everybody is blaming the government. Everybody is blaming the
Yes.
prime minister for doing this and that. Whereas on the hindsight, there could be a leak in the system that they are not following, or the rules or the chains of commands were not given it to him. That, sir, this is happening. What we
Yes,
should do?
when if it's positions on the ground, if we are talking about a health inspector in Ba,
Yes.
liaising with the subdivisional hospital in Ba,
Yes.
then the accountability is just within Ba. But
Yes,
we
of
are
course.
talking about the national positions here, the office
Mm-hmm.
of the Prime Minister, the office of the Minister for Health, and the Attorney General.
Mm-hmm.
They are accountable to the whole nation. So these positions, if you enter into these positions, by
Yes.
default of the title bestowed upon you, you are accountable.
You have to take an
And
oath before you take that.
every decision may mean, prosperity,
Mm-hmm.
happiness,
Mm-hmm.
everything is happy-go-lucky,
Mm-hmm.
or it may mean disaster,
Yes.
crisis,
Mm.
suffering, and depression, like what we are having here.
Going through at the
So
moment.
decisions were made or not made. It's still they were decisions made at that top level, and these are top level accountable positions. They
I got your
are
point there.
voted in those positions because they are accountable. Um,
Now that they are accountable, Johnny, now that they are accountable, what would be a measure from them? What would be a measure from the government in this situation? As we all know, the whole world, or everybody knows that everybody on the ground force have got access to internet. The general public, the population put them there to rule the government. That their lives are at stake, their lives are on their hand. Because if anything happens, what would be
yeah.
a clear indication at this current stage? What would the countries was this country was probably caught short on COVID situation. They probably it just probably slipped by. Everybody makes mistakes. We all mistakes. But now the mistakes has been made. What do you think the honourable bearers should do now? How should they handle it?
Um, Again, I'll just go back a bit.
Yes.
The people of this country have been wrongfully blamed for non-compliance
Okay.
by the bearers of these positions.
Mm-hmm.
The office of the Prime Minister, the office of the Ministry for Health, and the
Yeah.
office of the Attorney General have been blaming
Mm-hmm.
the citizens of Fiji for being non-compliant, and therefore there is a need to mandate,
Mm.
uh, to enforce, especially when we are now talking about vaccination.
Mm.
And that is unfair.
Okay.
That is outright unfair when we consider
Mm-hmm.
that these decisions were made and it was flawed. And because of that, this is the situation. Now, what do you expect from a panicking, fearful,
Society.
society whose livelihoods have been already been drastically affected from last
Yes.
year, and
Mm-hmm.
then now with the stringent measures because of this mistake
Mm.
in decision making? What do you expect from the public? So the in every public health intervention there is the principle of reciprocity.
Mm-hmm.
The principle of reciprocity, we have to be reciprocating. If you
Yes.
are going to be making public health measures, there's a responsibility that you will also have to look at yourself and ensure that you yourself are compliant to things first.
Yes. Very true.
What you are putting out, you must be compliant to it.
Practice what you
If
preach.
the people are seeing that the authority are non-compliant first, don't expect the people to be compliant.
I got you. I
That's
got
the
you.
principle of reciprocity in public health. Equality. People deserve to be treated equally.
Mm-hmm.
Um, and so, what do we do now? I think the authorities, the bearers of these positions, just need to humble themselves and honestly, just admit to the mistake. Admit to the mistake and say, okay, nobody is a bad person.
Yeah, of
Nobody is a
course.
bad person.
No, we
But
all
bad
humans.
decisions happen.
Yes, very
But
true.
bad decisions happen. And this is about bad decisions. And it's about bad decisions happening at the highest level of accountability
Hmm.
and transparency. And so the authorities need to come clean to the people and say, we made this mistake. And because of these mistakes, we have made decisions and blame and
So,
apologize to the people of Fiji.
have they
There's
done
nothing
that?
wrong with that.
Have they done that, Doc?
No,
Not at
no,
all.
they haven't done that.
Okay.
And that's it's the sad reality of what's happening now, because instead of doing that, the people are being punished. Already families are struggling, and then jobs will have to be taken away because of the no job.
Now, coming into that,
Um,
as you just mentioned, Doc, the no jab, no jab. Now, my point would be on that is, now, Honorable Prime Minister has been a leader in command in the army, and a commander in an army has got certain rules and regulations, and he functions a certain way.
yeah,
So, if he takes the office, he's voted in the office of the prime ministers, then he's briefed. His takings or undertakings are based on the whole office. That all the government that surround him, all the people that surround him, the drivers who drive him to work, or the drivers that bring him home, everywhere, every chain is all linked. So coming
yes,
to that, I would say, okay, no jab, no job is probably it's not a dictatorship term. It's probably a term released by the army commander. I can possibly see that. Now, some people will not probably see that, but the decisions made of that, let's say, okay, no jab, no jab, but the implications of any word comes from somewhere. Getting back to that, no jab, no job, and that's hitting the people at the moment. And as you said,
yeah.
it's hitting at the moment in the market. Would you like to elaborate on that, Doc?
Well, I'll comment on the comment about commanding the army.
Mm.
The Honorable Prime Minister is a former commander.
Yes.
He led an army, yes, but he is now the leader of a democratic country. There is a big difference.
Mm-hmm.
In a democracy, there's consultation, there's active participation,
Mm-hmm.
active discussions. You need to hear the voice of the civil society. You will hear the voice of the rest of the population. You will need to hear the voice of the private sector. These three pillars of a democracy, the civil society, the
Mm-hmm.
private sector, and the government, need to work hand in hand. As a leader, uh, as the prime minister,
Mm-hmm.
he is a prime minister of a democratically elected
Government.
government, and
Yes.
that's how democracy works.
Mm-hmm.
It's not conditional on what type of crisis or disaster. Unless you
Mm-hmm.
declare a state
Yes.
of emergency,
Mm-hmm.
then the rules change, and therefore you can start to dictate. There is no state of emergency here.
Yes. Very true. Gee, you're a hard man,
It's a
Johnny.
democracy happening, and so all these, you know, there's why aren't we as medical as collective members of a health
Mm-hmm.
institution? Why aren't we allowed to have conferences and discuss this out in the open? We
Mm-hmm.
haven't had that. We haven't had that.
So nobody was called in
Everything
for a
has
big
been
meeting.
pushed down our throat. You do this because this is what the WHO is saying, and
Mm-hmm.
we have. We
So
are a
there's
sovereign country.
no
We are
dialogues
an
were
independent
exchanged.
country. The WHO cannot force anything on us.
Mm-hmm.
Under the Constitution of the World Health Organization, it
Mm-hmm.
can only go to the extent of highly recommending.
Yes, very true.
Highly recommending.
Mm-hmm.
The decisions are made by each country based on their sovereignty. So we as collective health professionals in Fiji have the sovereignty to come together, discuss this issue, and advise government. We are the
Mm-hmm.
experts,
Yes.
not the lawyers, not the economists. We are the experts here. So our voice need to be heard,
I
and
hear you.
we need to have what we always have had: constructive debate.
Of course, of course.
That's best practices. Through constructive debate, best resolutions and way forward come out of it. And so an evidence may be presented, and 20 doctors will have 20 different opinions,
Mm.
and then we debate on it, and that's the beauty
Yes.
of best practice.
And
But
come up
that
with
is
a
not
solution.
happening.
Okay.
That is not happening, and that has not happened. And so the in that sense, I would say the Honorable Prime Minister
Mm-hmm.
and the Honorable Minister for Health has not been advised properly, in the
Okay.
sense of advice coming out of a collective, constructive, best practice type of debate.
Okay.
It's all about best practices. I mean,
Yes.
three brains and three opinions are always better.
Mm-hmm. So, in other words, there is no open dialogue with all the top shots, top notch doctors or no people that are working. They would have had a look. They could have had a forum and said, "Look, let's solve this together." So, what you're saying is that people are shut down. People are not being allowed to speak up. So, I think that's where people are reaching out on social media and
Yes.
voicing their opinion due to democracy, because it's a democratic world. They need to open the dialogue. They need to open. The mistake has been done. So what you're saying is they need to revisit the situation. They need to revisit. That's what you're saying, rather than putting out
Yes.
instructions and directions, because every country functions differently. India, Australia,
Of course.
population wise, every I
Of course.
understand that point of view, and I'm sorry to hear that if there's no dialogue that has been opened, and some dialogues would need to be opened. Now, it's a very interesting fact that you actually pointed out there, Doc, and I salute you for that. Now, what would be your recommendations? What would you suggest? How can we solve this? Let's go back and to the same question and say, look, how are we going to put this stuff in the bucket, and let's see how we can shuffle it. Say, for example, what would you do if tomorrow,
It is never
if
too late.
if a call
It is
comes to
never
you,
too late.
yes, if
It is
tomorrow
never too
come,
late to. It is never too late to to say, let's just do a situation analysis now.
okay, okay,
Yeah, let's do that. Let's bring in the epidemiologists. Let's bring in the public health experts.
mm-hmm.
Let's bring in some representatives of the Fiji Medical Association. Let's
Mm-hmm.
bring in the representatives of the Fiji College of General Practitioners. Let's bring in the representatives of the laboratory scientists, the health inspectors, the dentists, all health and allied health personnel that will have a perspective that is specific from their expertise
Mm-hmm.
on the current situation. It is never too late to do that now.
Mm-hmm.
If Parliament can organize itself and have a sitting, why can't health experts have a sit?
Mm-hmm.
And we have technology to allow us to do that without even moving away an inch from our homes or our
Mm-hmm.
offices. We
Mm-hmm.
can do that with technology, and we can have small conferences. We've always been doing that. The Northern Division having their own conference, the Eastern, the Central, and the West, and then we collectively combine what is the result of all these discussions, and then we have a much better expert collective advice to tell the government this is what we think is
Mm-hmm.
the way forward,
Now,
and
I
then
interview.
present that to the economists and the
Yes.
lawyers and the private sector, and then we can really map out our way forward. But
Mm-hmm.
to just dictate uh, terms when
Mm-hmm.
there are expert opinions that
Yes.
that are used to the constructive debate and resolution approach of
Mm-hmm.
best practices, um, that will never get us forward anywhere. And people, unfortunately, it will create suspicions, hatred, anger, and it will just amount to more suffering.
Mm-hmm.
Um, the pandemic itself has just created a lot of emotional turmoil.
Yes, I can see. I've been following that.
Yeah.
Now, in an earlier
Our people,
interview.
our people, our people deserve that.
Mm-hmm.
Uh, our people deserve uh, to be advised properly. Our people deserve better decision making
Mm-hmm.
than what's happening.
Now, on an earlier, very early interview that I did in one of the opposition leaders, opposition member a while ago, I asked the question as to about the open dialogue, because if you've got in Fiji, as you know, there's a lot of koros, there's a lot of chiefs, there's a lot of interiors, and a lot of people govern them. A lot of people govern them in their own sense, and they have their own managers out there, and they listen to the bosses of the village, for example, yay or nay. So my question was: has there been any open dialogue in those situations? For example, have people reached out to them and say, "Look, you need to get vaccinated. Why do we need to get vaccinated?" So have they been explained that this is happening, or they haven't been explained, or just a rule that people are following? Go and get jabbed, otherwise, you won't get a job, for example.
Uh, the Fiji's democracy has been in question for quite a long while now,
Yes.
because of the inability of the watchdogs
Mm-hmm.
of government to do its democratic uh, role.
Mm-hmm.
The civil society is shut down. Their voice is not being heard, and the civil society
Mm-hmm.
are the village groups, the koros, and that's civil society. It may not be formally registered uh,
Mm.
in the charitable trust parameters. It may not be formally registered, but it is civil society groups. There are the Songo Bakamaramas, the youth groups, the rugby clubs.
Yes.
Yeah, and the media is also a watchdog.
Yes. Very much.
The church groups, the faith-based organizations,
Mm-hmm.
these are also civil society organizations, and they have come under a lot of negative attention by the government, just by doing just by performing their role as civil society organizations actively participating
Mm.
in a democratic country and how it's running.
Mm-hmm.
And so that's how it's been. And so people have come to sort of indirectly accept that as the norm.
Mm-hmm.
And it is not. For a healthy democracy, All these voices have to be heard
Very true.
for
Very
a
true.
healthy democracy. That's
Now,
how we will tackle any problem, COVID-19 or otherwise.
now, Doc, I'm going to ask you this. I've been following a lot of social media, a lot of social things out there, a lot of people to see what if and but, and you'd probably say, hey, why did you come on board of these things? Why are you interviewing people? People may ask me, hey, Param, why are you reaching out to people? Are you against the government? I'm not against anybody. I'm here to tell a story to people. Now, why did you take up this story there, Johnny? Why did you yourself took up this story of this crisis at the moment? Why are you so vocal? You need to tell us, you need to tell me, you need to tell the audience out there. Whenever someone's vocal about a point, there'll always be negative effect coming through. And people have
Yeah.
been even ringing me for negative effects and saying you shouldn't be doing this and doing that. And they don't realize it's basically for awareness. As you said, it's a healthy competition out there, and I believe in in equal rights. Everybody can speak up. Everybody can speak up.
Yes.
So, Johnny, Dr. Johnny, why did you take this up on your shoulder? Why did you take the whole country's all this issues? You could have just shut up and not say anything. Why did you say that? Why are you making so much noises? Why? You could have just stayed in your
I like
farm
how
and
you put it.
enjoy.
Why am I making? Why don't I just shut up?
Yeah,
Thank you, Param. Thank you. Yeah.
just an idea.
Well, I know the struggle. I grew up in the outskirts of Suva in Gawia.
Hmm.
Uh, I was a wheelbarrow boy once. I sold plastic bag at the fish market.
Wow.
Uh, I know what it is to struggle, and I came out as a medical student, and that is and I'm grateful to the blessings of the landowners in Lami, the landowners of Lami, for allowing me to survive through Gawia and get to where I am.
Hmm.
Because of their generosity, thousands of people who came through Gawia in Lami are now well established in Fiji society like me. And the struggle is real, and I know what the struggle means because I lived through that struggle.
Hmm.
So that's why I will never allow a situation like this to go without raising my voice about it, because I went through that and I know how it feels to struggle. And I have had the blessed opportunity to be placed in the health system and have an experience of it. I have had the blessed opportunity to travel the world
Hmm.
through the health system. I have had the blessed opportunity to be actively a part of civil society.
Hmm.
And I am now having the blessed opportunity to be part of the private sector. So I feel I have had, I, I was taken through this experience trail for a reason, and I have to give back to my society. If my people are struggling and there's something I can do about it, I will
Hmm.
do it.
Because you could have just like any other doctors out there, any other physicians, moved to the broader countries
Yes.
for more money, a good life for your kids. You could have just left your farm there like anybody else and just like, oh, we left. Hey, look at us. We're here. We left. We are a typical example. You know what I mean? I love Fiji. Fiji is still my. I mean, irrespective to whatever the system is, I don't care. I
Yeah.
still love Fiji. Nobody says whatever. I don't care. I just love Fiji, and that's me. So you could have gone on your merry ways, taken the kids, hey, Bula Vinaka, bye, and just rang up and say, hello, I'm here. You could have just done that with all your
Of
experience and
course,
expertise.
those opportunities have presented itself, Param. And
Yes,
I'm not saying this to undermine the aspirations of my colleagues
yes.
or anyone else. We are all made differently. We are all unique,
Mm-hmm.
and this is my path. I chose this path, and my family have supported me throughout. My wife and
Mm-hmm.
the rest of my family and extended family, and because I am being well supported in choosing this path,
Mm-hmm.
um, I'm able to speak with confidence,
Mm-hmm.
and so yes, you chose that path, and there are things that you, but all of us, are working towards some common good.
Mm-hmm.
All of us, and all of us attack the target of the common good in one way or another by what it is we are qualified with,
Mm-hmm.
and our
Mm-hmm.
expertise and our extra qualities.
Yeah.
Like I found out from your sharing that you have a health background as well.
Yes,
And
I
so
do.
when I'm discussing health, you are well aware because of your experience, and you have a better understanding. And so
Yes. Yes.
that is why we are having what we are having today,
Yes.
because there's a part of us that's telling us we
Mm-hmm.
can see something about it. We can do something about it. Some of us much more than others,
Mm-hmm.
but that's why our callings are different.
Very true.
And that's why the responsibilities are different, but it also comes with some accountability and transparency and all that.
Yes. 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 Now, as Johnny, the doctor, what would your view be on the any your ethical views and moral views are obviously intact very much in whatever you propagate. So, what would be your view on the no job, no jab, no job policy on that?
Um, the latest evidence, brother, is saying that after having two jabs, um, your the ability to spread the virus and therefore the disease is the
Is
same
still the same.
as someone who has not had a jab.
Very true.
And
Yep.
so based on that, because the no jab no job law hangs on the spread, employers are going to say, no, I will not allow this employee who
Mm.
is not vaccinated
Mm-hmm.
because they will spread the disease to me. So the latest evidence says against that. So the no jab, no job law
Mm-hmm.
does not have evidence based justification.
Now, has that been stated into a law, or is it just a statement? Has that been fortified
It is
into
a
a
law.
law? Okay.
The OHS law was amended as a bill in Parliament,
Ah.
and so it is a law.
Okay. Okay.
And so it has made it through the highest court of the land, the Parliament
Mm.
House,
Mm.
the Parliament.
Mm.
And so, but the evidence is presenting it against itself.
Mm-hmm.
Even the Ministry of Health and Medical Services have made a video about it
Mm.
through Dr. Rachel Devi, who I believe is the lead person in this COVID-19 vaccination
Mm-hmm.
task force.
Mm-hmm.
And so she's on a video that was released yesterday afternoon at around 2:30 Fiji
Mm-hmm.
time.
Mm-hmm.
And in her video, which is the Ministry of Health and Medical Services speaking, she's saying that transmission is the same,
Transmission is the
whether
same.
you have had two jabs, and you can be positive after two jabs.
Okay. That's very true.
So that means that, if I may go back to the principle of reciprocity, if the government is saying, okay, our no jab, no job law was rolled out because of the evidence of spread,
Yes.
and then it's saying now that there's no more evidence to back it up, they need to reciprocate.
Yes.
The people are following, a lot of people have gotten their jabs
Mm-hmm.
because of the law, because it is enforced by law.
Because
Otherwise, they will lose their jobs.
Yes, very true, very
So
true.
the reciprocity role as a principle in any public health intervention has to be applied. And the government needs to be accountable
They
and
probably
be
need to amend
transparent.
that. Yes.
Yes, and review the law and be honest with its people and make a decision based on what they are seeing themselves.
Yes, because I mean, if there's a strict law like in Australia, we have, they say differently. They said if you don't have a jab, you may be deployed in other sections. Like as in my health sector, they said if you don't have a
Exactly.
job, you'll probably be, or you may be deployed in an area where you're less infectious to people because you are still infectious, and that is the
Yeah.
hard truth. But now coming back to that, that is something that which probably, and an encouragement with to the office bearers would recommend them to consider, or they would probably see, okay, there's a point we could look into it. And it's always good to bring out into a medium like this where something is heard, our voices are heard, your voices are heard. Now coming back to that, after that, coming back to the situation where then we come into the situation of vaccination. Now, Doc, what are your views on vaccination? Are you pro vaccination? Are you con vaccination? Or what is your view, general view on that at the moment?
I am fully supportive of vaccination as a medical intervention.
Okay.
Vaccination as a medical intervention, evidence-based, ethically based,
Got it.
proven, and have stood the test of time. If the vaccines have ticked all of those boxes, I am all for it.
Okay.
Measles, rubella,
Etc.
tetanus,
Etc.
all these diseases, the vaccinations for them have stood the test of time, evidence-based, proven to work amazingly. This is a new vaccine that has not been trialed. The trial is ongoing and it will end by 2023. It is listed as an emergency use listed medicine, mandated by the fact that COVID-19 is a public health emergency of international concern. And the mandate for that is accompanied by the need to establish data collection, because the trial is ongoing. We have to be collecting data on effects, side effects, immediate, medium term, long term.
Yes.
The box of ethics has been, I will put a red flag on it. Ethics. Once you try and enforce an intervention like that, that has questionable, ethical issues, the whole program comes under the microscope.
Of course.
And
yes.
we cannot, as medical doctors and medical scientists, ethics is always number one. And I'll just enlighten you, brother. If I, as a health professional in Fiji, if I want to do a research and I have designed my methods, my methodology, my data collection, my sample size, and I have created my hypothesis. This is my expected result of this research. I have to first of all apply to a research ethics committee.
Committee for an approval. Yes.
Yes, and the committee will first of all look at ethical issues around my study. Who is funding me?
Yes. Got it.
Is there a self-interest of the funder that will influence the result of my research?
Yes.
That is a big ethical question.
Yes.
And if they find that there are too many unethical issues or there are too many ethical red flags
They'll
surrounding
say,
my research,
they'll
it will
reject it.
either end up in the rubbish bin or it will be thrown back in my face,
Oh, you get a
and I
certificate.
will be told to tune it right,
Yes, yes,
address
yes.
these ethical issues
Yep.
before they even look at the scientific content, the hypothesis.
Yes, yes.
Yeah.
Mm.
So funding has a lot to do with ethics. And so, if you consider the reality of the need for universities and every institution to have funds,
Mm.
you will then realize that there are always gray areas of ethical considerations. In the publication of evidence,
Very
in
true.
in the when they allow for such research.
Yes.
We in Fiji do not do this kind of
You don't have
level
anything like.
one
Yes.
evidence based kind of research in Fiji. No, no, no. And in the Pacific,
Yes.
it's done mainly in the bigger countries, and so there is always a gray area. The pharmaceutical industry has, we all know they have the pocket,
Mm, yes,
they
of
have the
course, of
funds,
course. They find, yep.
and these institutions they need the funds. The universities, the medical
Mm-hmm.
universities, the general the institutions,
Yes, yes.
um, the research labs, and so. But for our practice, we have. I will say this with, this is something that we need to reflect on. I
Mm.
feel we have been practicing evidence based, meaning scientific based,
Yes, yes.
scientific content only. We
Mm.
have only been looking at scientific content of evidence. And for a long while now, we haven't considered
Mm-hmm.
the ethical issues that have come with evidence.
Okay. So a country
And we
like
have come
Fiji.
to a point now, Param, where this this has surfaced. Uh,
Yes.
and that's why a lot of people who have considered the conflict of interest issues
Mm-hmm.
with the pharmaceutical industry, they have been labeled as conspiracy theorists.
Well, there's about 10% in
But
the world population.
yes,
10%.
but this is about conflict of interest and the gray
Yes.
areas of funding and the
Yes.
need to survive.
Yes.
With all these institutions,
You're right.
things are becoming expensive, and we need funding. And these guys have funding. How
Yes.
do we
Manage the funding.
how do we maneuver
Yes, of
around
course.
around that?
Yeah, Johnny, supposedly tomorrow you get a call from the government and saying, hey, Bulavinaka, this is the Prime Minister calling to you. Come on board, you make some interesting points in the program there. I saw that, come and use your skills and help them through the crisis. Would you be open for that?
Oh, absolutely, absolutely. If it means that if they do that, then that means they are prepared to lend an ear.
Okay.
And right now, I will take it. It's an opportunity to share
Mm-hmm.
a viewpoint and an opinion. Whether they take that and whether that makes it into the final decision making, that will be on them.
Yes. Yes.
But if provided the opportunity, of course, I'll take it with both hands.
Now, what do you think as a health professional would you do to fast track in achieving the Bula bubble? Like fast tracking. Let's get the Bula bubble back into the country's revenue, which is the revenue is dependent on that. Now, how would you fast track that at this current stage?
Uh,
As you know, the Bula bubble
the
is so
Mula bubble.
important. It's so important. For me, obviously, it's important that, the flight gets open and I come in and have a bit of a drink, all those coconut juices and everything, and a kava and a bit of Fiji Gold.
I think it's time we stand up as a country and be counted. I think the bullying tactics of New Zealand and Australia have gone on for too long.
Got it. Yep.
We have the sovereign right and responsibility to come together first as health professionals, figure out the evidence, the ethics, and make up our mind
Hmm.
and say with absolute certainty and confidence, we are a sovereign country. This is the evidence that is relevant to us, that is us, that is represents us.
Hmm.
The evidence that you are presenting is about you.
Yes.
This is about us. This is representative of us. Do not force down our throats the evidence that does not
Affect.
respond, that does not represent us.
Yes. Yes.
Then
Yes.
we will be falsely represented. So we have the absolute sovereignty to do that. And if we just get our acts together and say, yes, mistakes happen, nobody's perfect in this earth.
Yes.
That's why we are still on earth and not in heaven yet.
Oh
And
hell.
oh hell, depending on our aspirations.
Yes.
But we can say, we can sit down and have a discussion. Let's come together. Let's not point fingers anymore.
Yes.
Let's just come together and mistakes happen, bad decisions have been made.
Yep.
What can we do to move forward
Exactly.
and speak as a country? We need to be speaking as one voice and as a country.
And even though Fiji is a small dot in the world, it makes a lot of noises. There's a lot of ripple. As you see, the ripple is quite big, and I think
We won.
I
We
like
are
a point
Olympic
you made.
champions, Param. We
I,
are
I
Olympic champions.
I like a
We are
point you made
Olympic
out there.
champions.
I like a point you made out there, Joni, that it's about time we speak up and bullying is probably I wouldn't use it, but in on the other term, I like the way you put it through. That I have been observing.
Sometimes we have to call a spade, eh?
Yes, it's that I've been here for about 30 odd years, and I can see what you're going
Political
through.
correctness has gotten us a bit too
Yes,
far down the
yes.
line of
I think we should not be too complacent, is probably the word. We should not be. It's about high
yes.
time we get up because I have been speaking on other programs to so many Fijians out there. And I tell you what, there are bright people out there. There are smart kids out there. And I think I'm
Yes.
so amazed to hear them speak the knowledge, the image they have of the thought process they have. And I think someone looks to tap into that to say, hey, come on. Hey, smart buggers over here. Let's do something about it. So I like that point over there. And obviously,
We are a salad bowl of brilliant people.
yes, yes,
Instead of focusing on our differences, we have to celebrate our diversity and the brilliance that comes with it.
yes,
It's
yes, yes.
about time we recognize that
Yes, of
we
course.
are
I
made
think,
up of a mixture of brilliant people,
yes, yes.
culturally
And
and
ethically.
academically and all that.
Yes, yes, very true.
So there's a need to celebrate that and
Why not? Why
and
not?
uh, and and harness. There's a lot of strength in that, and we need to do that
It's about time, eh?
right now. Our people are suffering. They deserve, much better action from us.
Hmm. So, on the point of that, Doc, that, we have smart people. We've got so many smart people out there, and it's commendable that the education system is obviously getting better and commending to the current government, which changes the law on education. And so many people are educated. Like yourself, you've been through trials and tribulations. You look where you are at the moment, and I'm sure you would be an inspiration to other kids out there to get up from that, koro and lift their flip flop and behind and go into shoes and take up a white collar job. And it's about time you stand in and say, look, we are Fiji. We do not only create ripples around the globe. So I think it's a very important point you made. It's about high time. People have to think out of the box and get to hear individually. Now, Doc, the vaccine, as at the moment, as you said, with the current COVID situation, it's a pretty bad situation. It's pretty infectious, and to overcome the infection, the spread of the disease, because at the moment it's kind of in a gray area as to 40% of income or the revenue comes from the tourist industry. And I heard a terminology that you used or somebody used that you should not keep all your eggs in the same basket. Was it you that used the terminology or somebody else I heard using it?
Yes, I use that, but of course I borrowed it from many people who have
Okay. Now I
who
was
have
trying
said
to
that before.
ascertain. I said maybe Doc's gonna come up. If you use it, then you're gonna come up with a great, brilliant idea over here. 40% of the revenue is coming from now. As you said, don't put all your eggs in the basket. Come on, Doc, give it to me. What do you reckon? Where should all the eggs go? What should you do?
I think we continue to underestimate the resources we are sitting on,
Okay.
and for a long time now we haven't tapped into the potential that is in our primary industry,
Mm-hmm.
agriculture and
Mm-hmm.
fisheries specifically.
Yes.
Uh, our economic zone that corresponds to our ecology is made up of more than 95% water, sea.
Mm-hmm. Mm.
The reason why a lot of countries are interested in us in the Pacific is because of our blue continent.
Mm-hmm.
That's a lot of food supply. We haven't gotten our acts together in terms of our primary industry.
Okay.
We have been monocropping in terms of sugarcane
Mm.
and pine in forestry, and that has been it. And our practices of agriculture has been about monocropping.
Mm-hmm.
We haven't tapped into the strengths that are in our local crops.
Who's the agricultural
First of
minister
all,
there at the moment? Who's the agricultural minister
sorry,
there? Who's the agricultural minister there at the moment?
I think it's the Professor Mahendra Reddy. He's the
Okay.
he's the honorable agriculture minister
Okay.
right now. Yeah.
There's so many resources out
So
there, so many lands available. Very true.
yes, for a long time there has been this break in the link between the fast-moving tourism industry
Quick money.
and our more than
Visualization.
95% subsistence farmers.
Okay.
95% of our farmers are subsistence farmers.
Okay.
And so, the complaint from the tourism industry all this time has been these people are not able to be consistent with our demand of quantity and quality. And the farmers are saying because they do not understand commercial farming and its principles, they are saying these people are not providing us market.
Mm-hmm.
And so there hasn't been an opportunity to fast track the hand holding process of our farmers to graduate from subsistence to commercial so that
Mm-hmm.
we are able to supply the
The demand.
the fast moving tourism industry. Now
Mm-hmm.
COVID is a blessing in that sense because the tourism industry has just come to a full stop.
Yes. Could there be
So
a
it is now an opportunity
to cultivate?
to graduate our farmers and organize ourselves.
Yes.
So
Yes.
by the time that the tourism industry is picking up its pace,
Mm-hmm.
our people are now ready.
So what you're
The
saying is,
agriculture, the fisheries.
let's keep a backup plan ready if something happens like
Yes,
that. And
yes,
this is a typical example that COVID is a typical example. Now is the time. Let's revisit the situation and say, look, we got to put some eggs in the industry over there, in the farming industry.
yeah.
What sort of things would you be? Do you think Dalo or Kava or things like that would be a good market out there?
We have so many ranges of local food that we haven't uh,
Produced.
even talked about.
Yes.
If you have, excuse me, if you have the opportunity to watch a Pacific Island Food Revolution show,
Mm-hmm.
the ultimate aim of the show is to show the superiority in terms of nutritional content of our local food and the range that we have. It's just that we haven't made our people aware, and we haven't made the world. We haven't. The Asians have done that
Yeah. Not even the
amazingly, and
world, the
that's why.
neighboring countries would start importing that.
Yes, yes. So for me, food and nutrition security for Fijian people first. That will address 90% of our health problems if we are able to source locally. Exactly.
Yes, yes, yes.
If we are healthier, we will be much more productive.
Any education going on? Do they have a special programs on television that morning? A slim guy, fit-looking guy comes up and say, "Look, physics. Let's do a 10 push-up, or let's do this." Any
Oh yeah.
active education programs going at the moment?
Oh yes, yes, yes. For the past decade, the Ministry of Health must be commended.
Okay.
The former National Advisor for Non-Communicable Diseases,
Mm-hmm.
Dr. Isimeli Tukana,
Okay.
his role in healthy living and well-being over the years must be commended. I give him credit
Mm-hmm.
for the work he has done in trying to get the multi-sectorial approach.
Mm-hmm.
And so not only health people have now taken on ownership of health issues. Now
Mm-hmm.
you have every individuals, trying to do something about NCDs, and that must be commended. A lot of
Yes.
people have put up their hands, and whether they are self-funded or collectively organizing themselves,
Mm-hmm.
fashion shows have raised funds for NCDs and all this, and so all that has to be commended. I must mention it here.
Okay. Great.
Everybody, and I thank Fijian people, those in
Mm-hmm.
Fiji and those in overseas,
Mm-hmm.
because of that. Robert Oliver and his role in the Pacific Island food revolution, um, and because that creates awareness of the superiority of our food,
Yes. Very true.
and how it is a hidden cuisine from paradise that needs to be explored.
Yes. Yes. Yes.
Um, and so, yes, a lot of people have done amazingly, and they have to be commended for their actions. Param.
Well, Doc, it's been a wonderful and it's been a pleasure. I got two more questions for you to go before we wrap up. The time has passed. We watched an action English film which takes about 190 minutes or so. We're just about the conclusion here. All the antagonist and the protagonist has come across, and let's see what the outcome of the film is. Okay. Now, would you be if you, for example, you were currently the health minister? Okay, you're standing in the big position over there. How would you manage this crisis? How would you have managed the crisis? On the red zone, the red alert, what would you have done, sir?
I will, if I were,
What would you have
if
done,
I
eh?
were the health, if I were the health minister. Well, um,
Well, obviously commending him as to what he has done and what he has been doing in the process of it, but,
yes, yes.
everybody makes mistakes and there's loopholes.
Am I being asked a question to go back retrospective, or what would I do now and moving forward?
What
Which
would you
one is
do?
it, Param? You cannot have
Well,
it all.
no, we'll
I'm
go
going to give you a choice.
do a bit of both. So we have a bit of a
Okay.
balance.
Considering the resources I had last year and the fact that COVID-19 was a new health issue,
Uh-huh.
um, I would not have done anything different than what the minister did, because he was acting um, in the context of
The guidance.
resources
Mm-hmm.
available and knowledge and information available to him.
Mm.
In the Nandi airport, I would not have allowed those two individuals to leave India, and pushed for government to compensate or
Mm-hmm.
to fund their stay in India until such time where our surveillance system can tell me as a minister that there is a green light and we can now allow
Mm-hmm.
the individuals to enter the country. But I will still enforce the full quarantine of 28 days, do testing, multiple testing, because the RT-PCR test requires multiple swabbing to really come to some sense of correct measurements. Then I will move forward, and because if I have done that, the Delta variant would not have entered the country. We can now sit together now as health experts without a crisis and say what is our way forward. And then I'll call on epidemiologists, public health people, every member of the health and allied health services, representatives from the various institutions, come together. Let's talk about our way forward from here. So that's what I would do.
Sounds cool.
If I
Yep, sounds
I
good.
am
You will make a good politician. Do you know that? Do you have any friends in politics there?
Oh yes,
Okay.
because of my blessed opportunity to have entered into the civil society sector, the private sector, and the government sector, and my experience with the military. I am well acquainted with a lot of the politicians and the leaders in the country.
Well, Johnny, you should
We know
make
each other
yourself towards.
personally.
You should make
We
yourself.
know each other personally, and we interact professionally as well.
That's good. It's always good to have a good two couple of brains together, to have a party. But you should look into it, and you should get abroad, and meaning abroad, meaning get into the one of those, the left or the right side, whichever one is your choice. I will leave that to the choice. But then again, you may be gunning for the right, but you may be voted for the left. You don't know. It's always a call coming from somewhere. Look, it's been a pleasure and wonderful talking to you, sir. You have a good day. And
Likewise.
in closing, what would you like? A little message from yourself to all those friends that have been watching you or will be watching the feed afterwards. What have you got to say on that?
To all people in Fiji right now who are living in Fiji, hang in there. I know the struggle is real. Mistakes happen, and I think we have to allow ourselves to right the wrong and be able to move forward. To our leaders, it's never too late to admit that we make mistakes and bad decisions, and allow our people to have an end to this suffering and have a light at the end of the tunnel. To all those, including you, Param, and to all our brothers and sisters who are out there in other countries who have Fiji at heart always. Thank you for your support. 322 million in remittances in 5 months. That's
Wow.
a clear indication. Yes, that's a clear indication of how much you have Fiji at heart.
Yes.
So, thank you all for the money. It has allowed for us to have a smile in these difficult times. So, Vinakapakalevu to everybody.
Well, Doc, all I can say, it's been a pleasure. I haven't met you personally, but we've just connected twice. And thank you to the associates behind the scene that has made this possible. And now I'm looking forward for another program which is called NCD down the track, and a few other people I'll be bringing to the forum, and I would like you to come on that forum as well, since I think that's a part of education we should hit in a couple of months' time, which is extending. COVID is here to stay, and advocate the best, I think, from our side, I would say. Enjoy. Stay safe on those Bulla farm over there, okay? And enjoy. And thank you for joining me, Doc. All the best.
Thank you. Likewise, Vinaka.
So, ladies and gentlemen, as the doc, as Doc makes his way, thank you, Willa Vinaka, Doc, and I will be talking to you and when I get off this feed. So it's been wonderful. It's talking to Dr. Jone Howea, of course, Howea. And I will leave the screen running for your comments there, because I've seen many comments coming, ladies and gentlemen. If you got a similar story, If you've got anything interesting, you're always welcome. You're always welcome to send me up. As I always say, it's a good, everybody's film is different. You may like romance, you may like drama, you may like horror. And if you're like someone like me who's always intrigued about watching certain things, there's no story which is good or bad. It's only your choices which is good or bad, because the stories are written and directed and made in such a way. So I try to pursue that today, and hopefully that you would have enjoyed the little story with Dr. Jone. We'll be bringing some more programs down the track. So keep tuned in. If you're for the first time here, please do consider pressing the like button so you get some information. And I'll run the screen for you so that you can make some... you can write your comments as I see you along for the next couple of minutes.